Hello and welcome to a presentation regarding disease prevention presented by Mariah Peterson. Disease and prevention. Disease prevention focuses on interventions that can be implemented within a population to prevent or minimize a disease. There's three types of prevention. Primary prevention includes aspects such as vaccination, supplements, and access to preventative services. Secondary prevention would include aspects such as screening or early detection of a disease, early provision of medications, for example, say for hypertension. Tertiary prevention includes aspects that reduce the impacts of an established disease and improving quality of life. So obesity was a chosen topic. We're going to examine the local and international problems that this has incurred over the last several years. So obesity as a local problem, socioeconomic factors play a huge role, with multiple studies finding that those in lower levels are at a disadvantage and are more likely to have higher levels of obesity. Local policies can promote health and wellness programs within the population by providing strategic funding to specific communities to improve health and wellness programs. Chronic disease as a global problem. So, according to the World Health Organization, obesity has doubled since 1990. It globally costs $990 billion annually, and adolescents are increasingly becoming more obese, with 390 million worldwide. Obesity is defined as a BMI equal or greater than 30. The World Health Organization has created an acceleration program to help combat obesity worldwide. Please see the next slide. So this slide here examines the World Health Organization and their response to specifically targeting obesity. So the acceleration plan is planned to be completed by 2030. Focuses on global advocacy for this specific chronic illness or disease. Focuses on nutrition. Focus on multi-sectoral actions such as food manufacturing and labeling. Poverty reduction, including taxing healthy food at a lower rate and higher taxes on unhealthy food. Subsidizes to promote healthy diets and activity among populations. And lastly, monitoring school food lunches, which as we know are very unhealthy. Preventative services. So for obesity, initially it would include primary prevention. So example of that would be increasing activity, improving nutrition among patients, and improving supplementation. They may be nutrient deficient in some areas. However, example of secondary prevention may also be involved. An example of this would be, screening for diabetes in patients with a high BM or insulin resistance. It could also be argued that tertiary prevention may be necessary. For example, this would include, say, an obese patient that may be having joint issues, may need joint replacements, or a obese patient that is insulin resistant or a type 2 diabetic, then they would need management of that disease as well, which would be a result of the obesity. So the best middle range theory that supports this, a little background on middle range theory, is created by Robert Merton in the 90s. Middle range theory basically creates a structure that promotes knowledge. There are specific criteria that is needed. So first, identification of the theory name, description of the theory's approach, grounding in the disciplines, in this case nursing, inclusion of a diagram model, description of use to guide practice, and then lastly, description to guide research. So for this one, I chose guided participation, middle range theory. This theory focuses on teaching and educating patients regarding self-care, and this theory I think would be useful in reducing obesity among patients. And this next slide here shows the diagram model of what these researchers are promoting. So again, you can see there's a learner and a guide, guided participation, and kind of goes through the issues and then the processes and competencies of the patient with an overarching goal. So thought it was a good diagram. So the role of the DNP in identifying gaps in preventative care specifically for the DNP focuses on prevention care and screening, encouraging nutrition and increased activity, being aware of healthy foods and non-processed foods, as well as nutrition labels. Community efforts such as community gardens are an example. And then the specific DNP essentials that correlate to this include health policy and improving health outcomes, which both again relate to obesity. And then these are my references. Thank you.